Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about what tests do periodontists do to find out what level of periodontal disease do you have. Let's start. So this is a very important episode for all the people who are watching this who are suffering from symptoms of gum disease, and as a periodontist I feel that it is my social responsibility to tell you or give you an idea in brief as to what do we do to find out what is the level or severity of your gum disease. Now first off, we always take an examination and we ask you about your symptoms such as chief complaints about food lodgement, bleeding on brushing, bleeding after brushing, any sort of pain after food gets stuck between the gums, a lot of pressure in the gums, that swollen feeling in the gums, or bad breath, for that matter spacing that has happened over a period of time between your teeth, or in severe cases that your teeth have started becoming loose and there are gaps and all those things. Now once you have told us these complaints, we will probably do some examinations. On top of that, we might take some x-rays or get a full mouth OPG, that's an ortho pantomogram scene, where we will talk about and we will see your bone levels. Now the bone level, I'll make another video on how to interpret an OPG when it comes to interpreting what is the almost a tentative level of your disease severity. Now once we all have this, we do 2-3 things that we have to check. On a very superficial note, I'll tell you something that we do 2-3 tests that are very important as a periodontist for us to check your periodontal disease activity and severity. Now severity and activity have two different meanings. Severity means how severe the disease is, and activity means how active the disease is. I know it sounds very weird. Severity means how much of a disease is happening, and active disease means where all it is happening very concomitantly, where it is happening more destructively. So that's known as disease activity. So we have some specialized instruments known as periodontal probes which have graduated markings. Usually we use a UNC15 probe that is basically demarcated or calibrated at 1 mm intervals. Why I'm saying this? Because 3 mm is the probing depth, which is usually considered as normal gingival sulcus depth. Now this is the depth which is amenable to oral hygiene regimen by the patient. That means when you brush and floss in the day, if you have 3 mm gingival depth or the gum depth, that is okay. This much depth is all right for you to clean your gums from the inside and make sure that your periodontal health is saved and restored and it is maintained. Now if it is more than that because of bone loss or any other things, then it becomes a problem. Then it becomes mild, moderate, severe and all those things. 4 to 5 is usually mild, anything more than that would be moderate, and if it goes above 7 mm it's probably going to be severe. Now how do we do periodontal charting? It's very simple. We use the periodontal probe and under local anesthesia we walk the probe circumferentially gently around the gums, in the gums, and we measure and do the periodontal charting, and we record the periodontal chart scores, as well as there's something known as clinical attachment level or clinical attachment loss, which is basically the distance of the reference point, which is usually the cemento-enamel junction, which is the neck of the tooth. That means the junction of the crown and the root, that is known as the cemento-enamel junction, and we see how much the gum has receded from that level. So that's known as clinical attachment level or sometimes clinical attachment loss. Now clinical attachment loss is not very relevant when it comes to periodontitis per se, because it is gingival recession. It is also a form of periodontitis, but the disease severity is seen with the help of probing depth. Now when you do a probing depth, it can be a lot, it can be different in different places, and also there's one more test which is known as bleeding on probing. Now bleeding on probing is very simple. For this we might not use a local anesthesia because it has a vasoconstrictor and that might reduce the bleeding. We just gently run the probe around for 30 seconds and we see if there is any sort of bleeding that happens after 30 seconds, and you have different indices for that, and depending upon how profusely the bleeding happens, is it isolated spots or is it bleeding profusely so that the whole margin is stained by blood, or the whole mouth is, sometimes in severe cases it is completely filled by blood, that gives us the idea of the periodontal disease severity. Now what you have to really understand is that these are all the decisions of the periodontist to make, and they will do all the tests possible, including some blood cultures maybe if required, and blood tests, hemograms, HbA1c tests for sugar and diabetic levels and other metabolic parameters, to make sure that there is no systemic involvement in your disease process, and then thereby after that they will tell you and formulate a treatment plan which will be suited as per your needs. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message with your name, your location, and the common oral health problem that's giving you discomfort, and just drop me a message in WhatsApp. Then I can have a word with you after 2 days, because I might not respond the same day. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.